We have about 15 participants now, so let's go on. The importance of 6 weeks. I'm going to share my screen with you. Okay. We're going to talk about the importance of 6 weeks. The postpartum visit is very important and very critical for the mother and the health provider. It is to ensure that the new mom has recovered from childbirth. Nearly all and every part of the body is involved during pregnancy. And we expect that after delivery, all the body function should have returned to normal. So by the end of 6 weeks, when the mother comes to visit, the doctor will check. She examines the woman. The doctor will examine the uterus, the once gravid uterus. I mean the uterus that had gone big and had expelled the baby. You expect that the uterus would have come back to normal, like your fist. We expect that by the time you come at 6 weeks, your uterus should be like the size of your fist, or almost, because some don't return completely to normal. And your doctor, we also want to make sure that you urinate properly. Some come back and complain about not being able to urinate well or to have pain when they urinate. So all these, your doctor will examine and ask you questions when you come for your postnatal appointment. Your doctor will also examine your breast. He wants to know whether you are breastfeeding well, whether your nipple is good. I mean, your nipples are good. He wants to know how you breastfeed your baby, whether you have the right knowledge of how to do it. And then he will also examine your breast to see whether you have cracks. Some may come and complain that they have pain on their breast. Some may even say they feel some lumps, maybe it's milk lump. All these things your doctor will want to check and then allay your fears. And then your doctor will also want to discuss with you, or you also might want to ask questions when you can resume your conjugal rights. When sex can return after childbirth. Some don't know when they can start. Some can keep, waiting for only God knows when. But when you come and you ask questions, your doctor can tell you when it is safe to start your conjugal rights. Also, your doctor will also want to discuss with you your choice of birth control, the type of birth control you would love to use. You can discuss this with your doctor. And during this 6 weeks postnatal check, your doctor also wants to ask about your emotional well-being, your psychological health. At this time, some mothers come and complain to their doctors about their they complain about some things not normal with them. They can come and complain about being persistently sad. They can complain of crying often. They can complain of, things that they don't do before. And when your doctor listens to this type of complaint, will know what to do. When you have emotional, we refer to these as postnatal blues or postnatal some call it depression. But you see, they are in different stages. But some experience the mild ones, and some others experience a more serious one. When a woman comes and complains of symptoms like, persistent sadness, crying, anxiety over how to take care of the baby, some even have panic attack. Some are irritable. A mother who is ordinarily, she's friendly and pleasant, and then suddenly she's irritable and angry. And then, a mother who is always very energetic and like to do this and like to do that, suddenly find herself not interested. Some can be angry, difficult. They also complain of difficulty in sleeping. Not only in the day, some can say, because they are busy during the day, they cannot sleep. But even at night, they cannot sleep. Imagine a woman who just put to bed. You will not sleep in the morning. You will not sleep at night. That is going to cause trouble. But these are the symptoms that the woman can complain about, during these 6 weeks postnatal visit. So when you complain this to your doctor will know what to do and how to help you. When you have these symptoms, mothers, please speak to somebody. You may not be able to handle it alone. That's why we always encourage that when you just put to bed, you should try to have somebody around who can help you. Your husband may not be around all the time to support you, but you should have somebody around to help you so that maybe during the day, after you are done with the baby care, you can have a nap. Or at night, you can, express breast milk or give your baby formula so that while you are sleeping, somebody who is helping you can help you to feed the baby and you can have a good night rest. And then, but when you have, a more serious symptoms, like you complain of a more serious symptoms like hallucination, paranoia, or when you think of, some can even think of suicide or harming the baby. Some are even confused or disorientated. But when you begin to notice this, within these 6 weeks, then you need to see your doctor. And at this stage, when you have these serious symptoms, we always call in a psychiatrist to give you advice and give you some things to use that will help you to be able to go through this period. But really, this period does not last. You will get over it. And that is for our 6 week postnatal visit. Then we'll go to the next topic. And let me also say that these symptoms that you feel, that some mothers feel during these 6 weeks, usually they are caused by hormonal shifts. During pregnancy, one of the hormones, progesterone, is higher in your circulation than the other. And as soon as baby is born, there is a shift. The one that is high go down, and the one that is low will go up. So, it is the shift in these hormonal levels that makes some mothers, to have such symptoms and such imbalances. But depending on the type of symptoms you have, your doctor will be able to help you. But please, if you have these symptoms, you cannot face it alone. You need the help of your doctor and the help of people around you. Now we go to family planning. One of the things that your doctor will discuss with you during your postnatal visit, your 6 weeks visit, is when to resume conjugal rights, that is when to resume sex after delivery. And then once you resume sex, you know that you can also get pregnant. Some people, 6 weeks after, in fact, 7 weeks after they have started menstruating. And once you start menstruating, you start ovulating and you can get pregnant. We have seen mothers who 6 weeks, 7 weeks, even a month after delivery, they will discover they are pregnant again. It's not good for the body. So that's why one of the things your doctor will discuss with you will be your family planning. Hello? Hello? Are we listening to me?
Hello, ma'am. We are here. Yes, ma'am. We are here. We can hear you.
Okay. So one of the things your doctor will discuss to you postnatally is family planning. Now, what is family planning? Family planning is the practice of you being able to control the number of children you want to have and when you want to have them. Most importantly, the number you want to have 2, 3, 4, and the ability to space them and have them at the time you want to have them. Not you have a child now, the child is 6 months, 7 months, and you're already pregnant again. You have cesarean section. You know this is not too good for you. So in order to avoid all these mistakes, it is better that during your postnatal clinic with your doctor will discuss with you and you will tell your doctor the number you want to have and when you want to have them. And also, will discuss with you the methods, the types of family plan that you have. Although sometimes most mothers, when they come, they already have the type they want to do. My friend has this type and she's doing well with it. I think I'd like to use it too. Or my friend has this type, she has problems with it, want to avoid it. But the doctor will let you know all the types of family planning methods that we have, so that you choose the one that you prefer to use. The methods of contraception that we have, they include long-acting and reversible contraception method. This type is long or it will be
Hello? Hello?
I think she has had internet problem. Let's just wait for her for a while.
Okay.
Can you hear me now? Hello? Hello?
We can hear you, although it's breaking in and out, but we can hear you.
Yeah. Oh, yes, network. I'm so sorry about that. So, as I was saying that yes, can we hear me now? Hello?
Yes, ma'am, we can hear you now.
Okay, yes. Like I was saying, we have the long-acting and reversible contraceptive devices, like implants. Implants comes in two types. We have the one rod and we have the two rod types. The one rod type can last for 3 years, and the other two rod type, which is called Jadel, can last for 5 years. These implants, we put them on your arm, your left arm. They are long-lasting and they are reversible. Once you remove them, then you can get pregnant. Can you hear me? Hello?
Yes, ma'am, we can hear you.
Okay, good. Okay, good. So I'm still talking on the long-acting and the reversible contraception. So we have the two types. Once you insert them, they can stay for 3 years, 5 years, you remove them. Once you remove them, then you can get pregnant. Then another one that is also long-acting and reversible is the intrauterine device, the one we call IUCD. That one you have the types that can stay for 5 years. The copper T can stay for 10 years. And anytime you are ready to start having children again, you can remove them. The ones for 5 years or 10 years can be removed at any time you are ready to have your babies. But for those who are done, you are hanging their boots, you don't want to have children again, you can leave it and you can stay as long as 10 years, as long as 5 years. You are good. There won't be any problem. Yes, and 3 years. Use the implants. Your period may begin to have the following characteristics, like you may not have your period at all. There is no problem. You may have your period normally. There won't be any problem. It comes the right time. It comes for the right period of time, 3 days, 5 days, and it stops. or you can just be spotting. You won't have period. Those are the things you experience when you use the long-acting reversible contraception, like the implants. Then you also have the hormonal contraceptions. Those ones, they include the pills, the injections. The pills, the injections, depending on how your body responds to it, they are all hormones. They contain estrogen, progesterone. They are all hormones. And all they do is to prevent contraception. They prevent you from getting pregnant. With injections too, sometimes you may have your period normally, regularly. Sometimes you may not have your period. And sometimes you may just be spotting. Then you have the barrier methods. For the barrier methods, you have the condom. There are some that they have used the pills, they have used the injection, they have used the IUD, and their body is not just, responding well to it. They have one issue or the other that will make them to just remove it. For such people, the barrier method will be very, very good. Like the condom, all you need to do, you combine the Billings method with the condom. You only use the condom only when you are not safe. With the Billings method is a natural form of family planning. For those who have regular periods, you will just note the time of your ovulation. And at the time of your ovulation, that is when you will use the condom. Before the ovulation, after the ovulation, you can do skin to skin. Then you also have the emergency contraception. This emergency contraception is advised only when maybe you find yourself having sex when you are not safe and you are not sure you may not get pregnant. So you can use the emergency contraception. Then the fertility awareness. This is when a mother who is breastfeeding and does not want to use any of these methods, but just want to use the lactational method of contraceptive. So in that case, the mother must be sure that she's around and available to breastfeed. When you breastfeed 24/7, then you may not get pregnant. But if you interrupt it, maybe you have to go to work, and while you're at work, your baby feeds some formula. Lactational method may not be advisable for women, for mothers who have resumed working. But a woman who is at home, a mother who is at home can use that, and she will be around to breastfeed the baby on demand. Then you have the withdrawal method. Well, the withdrawal method is not really, we don't always advise it, but sometimes you may have need to use it. So, and you know what happens just before the man ejaculates, you withdraw immediately so that you don't get pregnant. Then we have the more permanent method. That is usually the doctor will always counsel those who are not going . The more permanent one will be used. I mean, the doctor will advise you when you are not, if you tell your doctor that you don't want to have children again, you are done. For those who maybe have their children by cesarean section, once they say this is the last one, the doctor can then advise them, you can do the permanent form method of contraception, that is tubal ligation. Some will do it, some will say they don't want to do it. So for those who wish to do it, it is better to do it when you are delivering your last baby by cesarean section. Otherwise, it may not be possible again. Then the man can also have a form of contraception like having vasectomy. That is what men have. The man can also have a form of contraception like vasectomy. This is effective for men who don't want their partners to get pregnant again. But I'm sure that most men, they don't really do that. So this is the way these are the methods of contraception. Now, how do they work? Now we have discussed the methods. How do they work? The hormonal birth control, the pills, the injections, they work by preventing ovulation. They work by preventing ovulation. Then the barrier methods, such as the condom, they prevent sperm from reaching the egg and causing fertilization. Then the IUD, that's the one you insert into the uterus. They prevent implantation into the uterus. Then you also use spermicidal, especially those who use condoms. They also use spermicidal so that if the condom cannot kill the sperm, then the spermicidal will kill the sperm. Then after you have decided what type of method you want to use and you have taken it, you want to know how long does it start taking effect? How long does it start taking effect? For those who use the barrier method, it takes effect right immediately. But for those who use the hormonal method, we advise you wait for 24 hours before it starts taking effect. Not that you come, you take the injection now and you go home and, but we advise that you wait for 24 hours and then the hormones will start taking effect. Then some people, hello? Yeah, then some people want to ask, can you get pregnant with contraceptive? We'll say yes, you can get pregnant with contraceptive if, I hope you are hearing me, if before the insertion of the contraceptive method you want to use, if before you start using it, you are already pregnant. That's why when you come and we discuss with you, we ask you, when was your last period? And if you tell us the last period was like about 14 days, before you came, we will tell you that please wait, when you have your next period, the last day of your next period will be the appropriate time to give you whatever birth control method you desire to use. So, some people will say, my baby brought the copper T. It's because you were already pregnant before the copper T was inserted. So that's why we always say, is either you do pregnancy test and it's negative, or you wait for your next period before we give you whatever type you choose to use. So thank you very much. These are the two topics we have today: importance of 6 weeks and then family planning. You can unmute yourself and ask your questions. Hello? Let's unmute ourselves and ask our questions. Hello?
We are here, ma'am.
Yes, let's unmute ourselves and ask our questions. Let's unmute ourselves and ask our questions. Hello.
Hi, good morning, ma'am.
Yes, good morning.
I wanted to ask if these preventive measures, if they have side effects.
Which type?
All of them, I would like to know if they have side effects.
All of them, their side effects. Their side effect is to prevent pregnancy.
That's all. Like I wanted to find out if they give you symptoms like maybe sometimes you have headache or you feel some type of way while you're carrying it.
Yes. You know, the way you respond individually, the way you respond to pregnancy is the way you respond to these things. Some people in pregnancy, they don't have any issues. They are just good. They are pregnant and sexy. And you have some, they are pregnant and a lot of issue arises. So with contraceptives, that's why we ask you, like those, if you want to use copper T, we ask you if you react to jewelry. If you react to jewelry in any way, maybe if you put a neck chain and you have a skin reaction, or you put earrings, you have skin reaction, we say you should not use the copper T. And then for some people, when they take the hormonals, they tend to add weight. But we also tell them that if they have good eating habits, it will also reduce the weight gain. But if the weight gain is much, then they can discontinue it and use another method. Hello?
Hi. Okay, thank you,
Yeah.
ma'am.
You're welcome. Let's ask our questions. Importance of 6 weeks and family planning. Mothers, let's ask our questions. You may also ask questions that may not be related to this if you wish to, because I am sure some, they are still pregnant, they're in the first trimester, second trimester, third trimester. But it's good to discuss this topic so that when you find yourself at this stage, you will know what to do. Okay, let's ask our questions. Let's unmute ourselves and ask our questions. Hello, mothers. Somebody is asking, can someone be seeing period with contraceptive? Yes, I said it, that with the hormonals and with the implants, 3 things can happen. You can see your period normally, same day, same volume, but some, they may not have their period at all, and there is no problem. That's the way it works, and that's the way the body, that person's body is reacting to it. I mean, is responding to it. And then some, they can just be spotting, and it won't be more than that. So sometimes you can see your period with the contraception. I mean, the type of contraceptive you are using. And if you're on copper T, you can also see your period. Copper T, with copper T, you will see your period. The only thing is that if your period flows for 4 or 5 days, it may be more than, if it's 4 days, it can be 5 days. If it's 5 days, it can be 6 days. Not more than that. Let's keep our questions coming. Hello?
Hello.
Yes?
Good morning, ma.
Good morning.
Yeah, I have a question, but it's not relating to the topic.
Please go ahead.
Okay, so I'm currently in my first trimester, and I'm a first-time mom. So I'm kind of being conscious of the things I do. And so I have 3 questions, basically. So one of it is, I know I've read that it's best you stay on the left side when you are sleeping, so cause of blood flow and all that. But there are times that I find myself rolling and, sleeping on the right side or sleeping on my back. So what effect would it have on my baby? So I can be cautious of that. Then secondly, I read also that pineapple is not good for a baby. Yeah, most especially in the first trimester. I would like to hear from you if it's true or not. Yes, I think that's...
The third one.
I really cannot remember
Okay.
anymore, but I hope I remember before. Yeah, thank you.
Okay. The first question, the sleeping pattern, the sleeping position. You see, we say, use any position that is most comfortable for you. Use the composition that is most comfortable for you is what you should use. Let me tell you, if you sleep on a particular position and you are not comfortable, you will wake up yourself and change your position. That is that. Then 2, pineapple is fruit, except you personally react to it. If you don't react to it personally, pineapple is good because it's fruits. It helps, it gives you roughage and it gives you sugar. If you're hungry and you take pineapple, it will somehow alleviate the hunger. So pineapple is good. There's plenty of fluid in it and there's plenty of roughage. So it's good.
Okay, ma, thank you. I've remembered the third one. So the third question is, so because of the kind of work I do, sometimes I don't get to eat until 12:01. Is it bad, or would they have any effects?
And because you're pregnant, it is advised that you eat on time and not starve yourself, because that's why some pregnant women, they faint. Because when their blood sugar is low, you are not feeding yourself alone, you are also feeding your baby. So you need to eat, find time to eat. I'm sure your colleagues will not mind if you tell them to please give you some time to go and eat. They will allow you. And you should also have a break period, which you should also use. So don't, you can, if you don't eat on time, you can develop ulcer, and it's not good for you. So I'll advise that you should make every effort to try and eat find time to eat, no matter how busy you may be. Okay?
Thank you very much, ma'am.
You're welcome. Somebody is asking, what can I do to improve lactation at 39 weeks? What can I do to improve lactation at 39 weeks? At 39 weeks, you are almost there. And what you should be doing, like we always say, is, we say every month, if you can do it, every month, rub Vaseline on your areola, nipple before you sleep. And when you wake up, as you are having your bath, wash your breast. Whatever dirt or anything that may be there, you can wash it off. The Vaseline or the oil will have softened it, and as you have your bath, you will wash it away. When you do that, it will help to clear the nipple and the holes of any crust that might be blocking it. And then if you also notice that you flat nipple, then you can begin to work on it. It's called nipple belt. I've not seen it, but I understand we have something like that. If you see it, you can buy and put it over your areola and nipple and see whether it will help you to bring the nipple out. But it's good that you can use your hand to begin to stroke on your nipples to make it to come out. Okay? Then there is another person that is asking, my baby is 3 weeks now and he cries at night. Although his navel is yet to close completely, what can be done to make it close quickly and also help him to sleep more at night? Well, for the navel, it's a gradual process. It will close eventually. So, but just clean with spirit and cotton wool to keep it dry and clean. Then for the discomfort, you need to find out the type of, the discomfort your baby has that is preventing your baby from sleeping and crying. You said at night. I will advise that before you put your baby to bed, check the diaper, make sure your baby has fed and your baby is full, and then your room, if it's too cold, keep your baby warm. And if it's too hot and your baby is sweaty, your baby also can cry. So when you make sure that all these are in place, you can carry your baby and rock your baby. Sometimes they just want you to carry them. That's all they need. They just want you to carry them. Some people put their baby on their chest to sleep, and the baby will just sleep. So I'll advise you try any of this method and let's see what happens. And if nothing happens, maybe you can see us in the hospital. Thank you, Bola. Am I able to answer your question? Bola, am I able to answer your question?
Yes, ma. Thank you very much, ma.
You're welcome. So let's go to, somebody is asking, I'm 33 weeks and I've been experiencing swelling in my legs. Sometimes it swells up to my legs. Is it normal? What can I do to manage it? 33 weeks, swollen legs. First of all, when you get to the hospital for your antenatal clinic, please tell your doctor. But while waiting to see your doctor and discuss with your doctor, I'll advise that you put your legs, when you are sleeping, put your feet on a pillow that is a little higher than your waist. Then 2, when you sit in the sitting room where you can have something to elevate your feet, you can put your feet on a stool. That will also help it. And then if you're taking too much, if you go to the clinic, to see your doctor, you check your blood pressure. If it is okay, then it means maybe standing too much or walking too much, may contribute to the swelling. All the suggestions I've given you should be able to help it. Otherwise, if your blood pressure has issue, your feet are swollen, and when you check your urine, there's protein in it, then your doctor will tell you what to do and give you medication for it. So, Folashade, have I been able to answer your question?
Yes, ma'am. Thank you, ma'am.
Thank you. Some says drinking Zobo can induce labor. Not at all. I'm not aware of that. I don't know that. Please don't induce labor by yourself at home. Come to the hospital if you know you are term and your baby should have come, or your baby is late. Come to the hospital, discuss with your doctor, and your doctor will be able to help you. Somebody is saying, what can induce labor? Induction of labor is what should be carried out in the hospital and not at home. Please, if you are late, see your doctor. Thank you. More questions? More questions? Let it keep coming. Yes, somebody says, please, I gave birth since July 17 through CS. Can I do family planning now? Very well. Yes, you can do family planning now. Please come quickly so that we can discuss and you can make your choice and you can do your family planning. Any more questions? Are we there? Hello, mothers. Unmute yourself and ask your questions. Somebody is asking, how long does it take for stitches to dissolve? Hello? Hello?
Hello, ma.
Okay. I want to be sure you're listening to me. How long does it take for stitches to dissolve after delivery? Sometimes it depends on your body, but we give it 7 days. By the end of 7 days, the stitches are already in shreds. Parts are absorbed, parts are falling off, especially when it's on the episiotomy. By the end of 7 days, end of week, the episiotomy is closed. The stitches, those that will be absorbed would be absorbed, and those that will fall off would have fallen off, and your episiotomy will be intact. Have I been able to answer your question? Hello?
Yes, ma. Thank you, ma.
You're welcome. So let's keep our questions coming. I've told you you can ask questions that may not be related to family planning and your 6 weeks.
Is my mom teacher? You know my mom teacher though.
I'm on Zoom.
Moshe is your teacher. Moshe is your teacher.
I'm in a meeting.
Ask your question. Or you want the children to ask the questions for you? Let's ask our question, mothers. Hello, mothers. Ask your questions. Hello, somebody is asking, is it possible for the mother to breastfeed the baby after a CS, or how is it managed? Hello? Can we hear me? Yeah, okay. Somebody is asking, is it possible to breastfeed after CS, or how is it managed? It is very, very possible to feed, even on the table, while you're on the table. As soon as your baby is cleaned properly and dressed up, your baby will be brought to you for you to see your baby, and then you can the baby to start sucking immediately. For some mothers, lactation starts immediately. Once the baby is out, you press their nipple, milk starts coming. For such mothers, you just put the baby to breast and they can continue from there. But it is only those who maybe after 2-3 days before they start lactation that then we can now arrange what baby can eat before their mother starts breastfeeding. Shade, are you okay with the?
Yes, ma'am. I was just wondering, what if the mother is still not stable at that time? Like, while recovering, is it still possible to breastfeed?
Hello.
Hello, ma'am.
Yes, Shade, are you okay?
Yes. I didn't get it. The network is bad.
The question about feeding your baby after CS. Can you hear me? Can you hear me?
Hello, Mike.
Hello?
I can hear you now.
Yes. Yes, I said your baby can feed immediately after CS, even while you are on the operating table. Okay. Once your baby is cleaned, we bring your baby to you and you can put your baby to start feeding. For some people, like I said, as soon as their baby is born, they're ready to start breastfeeding, and we put their baby for them and they start breastfeeding.
Okay.
Yes. Somebody said, at what week will a first-time mom experience a baby's kick? From 20 weeks. About 20 weeks. Damilola. Hello, Damilola.
Hello, ma.
Yes. Somebody saying, at what week can the first-time mom start experiencing baby's kick? Before 20 weeks or thereabouts. Before 20 weeks, you can begin to feel your baby kick.
Okay, ma.
Yeah. Let's keep our question. Okay. So I want to assume that we all have gained one thing or the other in today's topic, today's discussion on family planning and our 6 weeks visit. So if you don't have any more questions, I want to thank all of you for coming to the platform and listening. Thank you for asking questions. And if there is anything you also want to clarify, when you come to the hospital, please ask for Mrs. Adesina. I'll be ready to help you out.
Thank you, ma.
Thank you, Ma.
Thank you for attending this Antenatal Class on this forum. Thank you.
Thank you, ma.
Thank you. You're welcome.
Thank you very much.
See you in another fortnight. So bye.
Bye.